Wounds can come from anywhere. Some of them may need to be surgically closed. So the majority of the wounds that I've seen here, whether they be from spinning, whether they be from, they just tear their leg on something. A lot of them don't need to be surgically closed, but it's really hard to tell, and sometimes it's really hard to tell on a dog that is so heavily coated as ours. So we talked about our dogs are specially bred from Hungary, and they have these super thick coats with several layers. So sometimes it's hard to know if a wound actually needs to be closed or not. If they do need to be closed, the safest thing to happen is for me to close that wound within 6 hours. Okay, that 6-hour window is called our golden period. And what that means is that if I close an open wound within 6 hours, it is a lot less likely to get infected. Okay, so this goes back to what we were talking about. If something happens, I want to know about it sooner rather than later, because that lets me do my job more effectively, prevent infection, and ongoing complications. If you notice that your dog has a wound and that it's bleeding, what I want you to do is place manual pressure. Okay, again, manual pressure is a fancy word for put your hand with a piece of cloth over the wound and hold it there. You want to hold it down for a few minutes. People have a tendency to, hold cloth on a wound and then look, and hold cloth on a wound and look. And what you're doing is there's actually a process in the body that's clotting that blood, and you're disrupting that clot. So you want to just hold pressure there, always with clean material. There's discussion in regard to bleeding wounds and tourniquets and things. I'll tell you, in all of my years working in emergency, I've never had to use a tourniquet. There will be tourniquets for you guys to use if we think we need them, but sometimes it can do more harm than good. You guys at some point will be provided a medical kit for your dog, okay? But before we do that, we want to make sure that what is in there is appropriate to help your pet in the field. And we'll be going through all of that together, and what's in there and how to use it. Has anybody ever been around a dog that had a bleeding open wound before? Yeah. Bad?
To the vet, so we have to hold it and cut it up.
Cut it open. Yeah. So, important things to know. If you're noticing a wound or a laceration on your dog, and you want to look at it and try to maybe say, how bad is this, where is it coming from? The first thing I want you to do, always, 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 is put a muzzle on your dog, okay? Unless it's being heavily restrained around the neck by someone else, you should muzzle your dog. Anybody have any idea why that is? Yes. So, painful dogs will bite. I've seen dogs that are like the most complacent house pets, super sweet. If they are in pain, they can bite you. And again, we're trying to avoid things like that. We use a couple of different types of cleaners. One is called chlorhexidine, the other is iodine. All right, iodine's available over the counter. You probably have heard of that before. When we use iodine, we usually dilute it to the color of beef tea. So I never use full strength iodine. Okay, it's too strong and it can disrupt the cells. I never, ever, ever want you guys to be self-cleaning with alcohol or peroxide. Okay, those things can damage the tissue, they cause a lot of pain, they're not as effective. So there are approved wound cleaners, and alcohol and peroxide are not those. A lot of times what we'll do is we'll first clip or shave the hair away from the wound. Okay, that allows me to get a clean sight around that wound to actually assess the wound and see how bad it is. Sometimes they'll need stitches, sometimes they'll need sedations. One of our dogs, Replay, actually had a wound around his neck that I thought was going to need a surgical closure. Once I shaved it and cleaned it, I realized that it didn't need to be closed, so that's good. And that's the point of clipping and cleaning. If your dog maybe scraps with one of the other dogs and they get into a fight, now they should never be together, they should never be in a vicinity where they can get to each other. But if something were to happen and two dogs, are going to fight, and there's actually bite wounds, it's really important to know that it can actually affect the tissue under the skin that you can't see, okay? It'll create something called a pocket, all right, that's not visible to you. The only way that we know if a pocket is there is if we actually sedate the dog and explore the wound with a probe. Those wounds often have to be flushed. Sometimes drains have to be placed. So why is this important for you guys? It's important because if you know that your dog got attacked by another dog and you know that there was bite wounds, I need to assess that because it's probably worse damage to the tissue than what you can see outwardly. Again, the longer you wait, the more likely infection is going to set in. If there are any kind of lacerations, wounds, or anything like that, often we'll do antibiotics and anti-inflammatory